Today's Ask the Doctor segment is all about hernias, a painful issue. Dr. Tim Christopher is a general surgeon with Shelby Baptist Medical Center. Joining us now to take your questions. Here's the number, 741-9272. And Dr. Christopher, we already have a caller. Let's listen to Melanie from Birmingham. Melanie, what's your question?
Hello, yes. I wanted to know what the limit on umbilical hernias were.
The limit on umbilical hernias.
The limit on having it repaired or limits on...
Repaired.
Okay. An umbilical hernia, I guess we start back. An umbilical hernia is at the belly button. So hernias are just a natural weakness coming through, a defect at the abdominal wall at the belly button. There really is no limit on how big those hernias can be repaired. Obviously, the larger it is, the more difficult the hernia may be to repair. The larger the hernia defect, you may need to use mesh or other things to help in that repair, but really we don't put a limit on that. Other factors that may be a variable is your weight, health conditions, and other things like that that may influence how the hernia is repaired in your recovery. Does that answer your question?
Not all of it. What
Okay.
if you've been told that you can't have any more hernia repairs, but it's still bothering you so bad until you have to stay in the bed?
Right, yeah. Which, if you've been told you can't have any more repairs, again, that may be a combination of things, of your underlying health issues or the complexity of that. So if you've been given that information, you may want to seek a second opinion. Somebody else may have a different approach or a different opinion about that. But if it's causing that much significant difficulty, you may want to have a second opinion about that. See a surgeon to reassess that.
Okay. Our next caller is Jenny from Coleman. Jenny, what's your question?
Yes, I have a hiatal hernia, and I've had it for several years. I have been seeing a doctor for it. They ran some tests. I'm having like a stabbing pain underneath the breast, and the pain goes into my back.
Right.
And it's really, it wakes me up in the night. It gets to hurting so bad. And I'm also having problems swallowing.
Okay.
Sometimes when I'm eating, the food gets stuck, and I have to get up and walk before I can get the food and stuck.
Yeah.
And I was told that they don't usually do surgery on a hiatal hernia.
No, we do fix hiatal hernia repairs. Now, to describe to everybody else what a hiatal hernia is, most hernias we describe are on the abdominal wall. Hiatal hernia is coming through where the esophageal hiatus is, where your esophagus comes down through the back of your chest and into the abdomen. It's the junction there between the esophagus and the stomach itself.
It's an inner hernia.
It's an inner hernia, right. Okay. So you don't see it. It's not something that you would bulge or feel out, but the stomach itself can herniate up into the chest. Now, sometimes that can be very severe. Like as you were describing, I was anticipating you're having difficulty swallowing and all those other things. Nighttime cough, a lot of times people have recurrent pulmonary conditions, recurrent pneumonias and bronchitis and things like that that can be related to the reflux. Now, most people that have a bit of a sliding hiatal hernia, which is the most common type, that they'll just have heartburn or reflux, they can take over-the-counter medicines or take an antacid like Protonix or something else like that, and usually will relieve their symptoms. More severe or larger hernias, you're having more reflux, or if that's not controlled, or sometimes the stomach can get up there to such extent that it can put pressure. You feel like you're having a heart attack. It puts pressure behind your heart. Sometimes it can be difficult to breathe. Some of those surgeries can be major to fix, but really that encompasses, most of the time we can do that laparoscopically through small incisions, bring your stomach back down into the abdomen where it belongs.
So there is surgery for it?
There is surgery for that, correct, yes. Okay. There is absolutely surgery for that. Now, there's different ways to approach that through the chest or through the abdomen. Most commonly it's done through the abdomen. The issues are bringing it down is the esophagus long enough. Now, a lot of the workup, you need to have a gastroenterologist assist in the workup to look and assess to see is everything anatomically in a good relationship. There may be other reasons you're having difficulty swallowing.
Okay. We have one more
sure.
quick caller here. Chuck in Hoover. Chuck, your question.
Yes. My question is that I will be seeing a surgeon Wednesday at Shelby, Dr. Barton Woods, about a hernia, and I have been having like pains in my lower extremities, like on my left side, and I was just curious about the possible surgery and the recovery time.
Okay. Is it an inguinal hernia down in your groin?
Yes, sir.
Okay. And I know Dr. Bart Wood well, so he will take care of you. An inguinal hernia is probably one of the more common types of hernias. It'll be a pain or a bulge in your groin. Can be on the right or the left. Those usually reducible. When you're up or straining, it'll protrude more, and usually those are associated with more pain. The more coughing, lifting, straining you're doing can be associated with more pain. The repair is usually straightforward. The repair is usually done as an outpatient. A lot of times these are even done laparoscopic, or now we're doing those robotically, and those can be done robotically at Shelby. That is something that is outpatient surgery, 3 small incisions. The typical recovery is usually about a week off work from a kind of a desk type job. Now, heavy lifting or straining, we usually allow about 6 weeks of recovery time before we put into heavy lifting or straining. Really, we introduce mesh in there in the backside of where that hernia is being repaired, and we need that mesh to get good and well ingrown before you put it under a strain. Okay. Does that answer your questions?
I think that's all the time we have.
Okay.
Dr. Christopher, thanks for being with us. But
sure.
Bottom line, if you've got some issues, get some medical help. Go to a doctor.
Exactly. You need to have those checked out.
All right. Dr. Christopher, thanks very much.
Thank you.
Hey, coming up.